Good afternoon, I'm Dr. Deuk, and we're here at the Deuk Spine Institute in Melbourne, Florida. We're getting ready to perform the Deuk laser disc repair on a patient who travels all the way from Cocoa, Florida, 10 minutes away. She has back pain. It goes into her right leg primarily, but both sides. She's having leg symptoms from pinched nerves on both sides. So, Jordan, I would either drop the table or do something to bring it just a little bit further down, maybe. All right, good. So everyone agrees we're doing a bilateral 4-5 and a right 3-4, correct? So I'm going to start by accessing the 4-5 on the right side. Shot. Shot. How's she doing, Dr. B? Shot. Shot. What's wrong? Shot. Berndes, don't scare our young nurses this way. So we're in at 4-5 on the right. Now we're going to do 3-4. The first step of this surgery is to put in some needles. We're going to make a 7mm cut. The whole surgery is done through this one little cut, 7mm. It's a relatively bloodless surgery. Henry, let's show our audience, why do herniated discs cause so much back pain? Shot.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Shot. All right, we're getting close to being ready to wake her up. Shot. We're just about done. We've got our needles in position. Is she okay?
Just checking to see how she's
Shot. All right, so she's got basically two herniated discs, L3-4 and L4-5. Is she okay? And the L3-4 disc herniation is on the right side. The L4-5 disc herniation is on both sides. And when I asked her, where is your pain? She showed me this right here. It's in this area. Specifically, I asked her where. She pointed here and here. Okay? Now, when I looked at the MRI, I saw that this was L3-4. That's the L3-4 disc. And she had a tear. We can get rid of that. On the right side with a herniation sticking out. Then at L4-5, that's the next disc down, she had a tear on both sides with herniations on both sides, pinching her nerves. going down her leg. So I said, we need to fix both sides at L4-5 and the right side at L3-4. She has both back pain and leg symptoms. How long has she had back pain for? No, I'm sure it's gotten worse in March. How long has she had it? So we don't know. She's had some balls. All right, she's had back pain for at least, what are we, July? So let's just say 5 months. It's gotten worse over the last 5 months, okay? All right, now we already made a little cut over here on the right side. And we're just waking her up so she can help us. We want to do what's called a discogram. We want to find out if her pain is coming from these discs. Let me know when she's wide awake. All right, Henry, have we run the video already on what causes back pain?
Correct.
All right. Is she reliable? The blood pressure's a little high. Are you okay? All right, I'm going to let Dr. Berndes treat her blood pressure, and then we're going to test her discs. So I'm just going to wait a minute. Louise, you mind holding this here? So remember, we already made the cut on the right side because we had 2 needles, so we have to make the cut. Okay, so we know from the video we just played that back pain comes most commonly from a tear in the wall, the back side of the disc, called the posterior annular tear. And if you have an annular tear, it doesn't cause back pain. But if you have a herniation into the annular tear and you get inflammation from that, that's what causes the back pain. But a tear by itself doesn't cause back pain. A herniation by itself doesn't cause back pain. The pain comes only when you have inflammation in the tear from the herniation. So you got to have 3 things: tear, herniation, inflammation. Okie dokie. All right. Are you comfy?
Are you comfortable? Are you having any pain? She said no, no pain.
All right. You comfortable?
Yes.
How bad is that on a scale of 1 to 10?
Give us a number. Give us a number. 10.
Is that where you get your back pain?
Is that where you get it?
Is that typically where you get your back pain? Is that where you get your back pain?
Is that where you get your back pain?
All right. 10 out of 10. L4-5. We all agree that's L4-5, right? And that's the level we're treating, correct? Yes, sir. It's amazing because you can see from the discogram there's tiny tear, but if you look at the MRI, there's a huge herniation. You can see some blush of the dye going into the herniation, barely on the x-ray shows that. Jordan, on that lateral x-ray? Yeah, you can see a blush there. No, further back. Other way. Other way. Towards the foramen. Keep going. You see that? Yes, you see that shadow? All right. She better? Is the pain gone? Is she reliable?
How's your pain doing? Your pain okay? How's your pain? She said yes.
Look at that on the other side, by the way. You guys see the other needle? It's got dye in it, blue dye. Because we did the discogram on this side, filling the disc, it filled the needle on the other side. All right, is she comfy? Yeah. Any pain? She's
Are you having any pain right now?
still a little
She said no.
sleepy. How bad is that on a scale of 1 to 10?
Give us a number. She said a 10.
Is that where you get pain typically?
She said yes.
All right, 10 over 10. You can put her back to sleep. I wouldn't put her too deep. But so she had 10 out of 10 pain at L3-4 and L4-5, concordant on both, meaning it's her typical pain. All right, at this point we're going to start our DLDR. We'll start at L4-5 on the right. So we know these 2 discs are causing her back pain. They both need to be repaired. Shot. I'm going to remove the needle and leave the guide wire. We're going to use this guide wire to guide our dilator down into the disc so we can repair the disc. She seems to be quite nicely laying here comfortably, so I wouldn't sedate her too much. Shot. You're doing great. Now she's responding a little bit more.
Okay, sweetheart.
All right, you're okay.
I'm gonna give you some more num-num.
I don't know how much more num-num I can give her. We're at the disc. We use some num-num in the dye, right? Well, she's definitely awake now.
Sarah?
Let me know when you want me to proceed. All right, so you can see from the dilator, Jordan, go ahead and point it out. The tip of the dilator is low within the foramen, right at the back of the herniation. And that's why she's uncomfortable. She's feeling the tip of this dilator pushing on her painful disc herniation. Now, the first person to describe that was a doctor by the name of Cloward. He was a spine surgeon who suspected that herniated disc caused back pain, and to test it, when he was doing surgery on the spine, he would push on people's bulging discs, and he said, oh yeah, it creates all this pain. So he was the first one to observe that. Oh, now you can see the tear, the herniation better, right? You guys see that? Some reason the dye came out better now. Okay, now we're going to put a tube down, and we're going to do the entire endoscopic spine surgery through a small tube that's really internal diameter of about 5.5 millimeters. There we go. That should be it. All right, remember, what's causing her pain in her back and down her leg is the annular tear and the herniation. Jordan, you want to take the fluoro out? Any questions from the audience?
No current questions.
All right, we've already showed the video on how herniated discs cause back pain, right?
Correct.
Why don't we show our video on how the Deuk laser disc repair works?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, welcome back. And now you can see we've introduced the laser fiber. The laser fiber is that glass pipe you're seeing, the tube, and that fiber transmits laser energy from the laser machine over to the herniation and annular tear, so I can clean it up. It would be virtually impossible to do the surgery without the laser fiber. The name of this surgery is the Deuk laser disc repair, and it's named after the fact that it was developed first at Deuk Spine Institute by Dr. Deuk Majan, that's me, and it involves the use of a laser, very important, because without the laser this surgery is not possible. Without this laser, you can forget about fixing people's discs properly. If you have to use metal instruments, a bit old-fashioned. We still need them to cut the skin and still need them to get into the disc, but once you're here, we want to use a more advanced instrument, the laser. Now, these lasers, of course, are all FDA approved. The FDA has approved the laser and the fiber. You can see the damage to the disc. The damage that I'm seeing here is clearly older than 5 months. But her symptoms got worse about 5 months ago. And that's probably because she had some more herniation happening. We need a blue towel there. All right, any questions from the audience?
No current questions.
Let's run our video. Did we run the video yet on how the Deuk laser disc repair works?
Yes, we ran both.
In that case, we'll just work. This will be our last surgery for today. We saved the best for last. The other patients that we operated on earlier are gone home or back to their hotels. We have patients from Massachusetts and Mississippi. And our first patient was from, where was our first patient from? He was from Chicago. So we had Chicago, Massachusetts, Mississippi, and this one is from Florida. All the way from Florida.
Where?
All the way from Florida. I'm joking. She didn't have to go too far to find us. At this point, 80% of our surgery patients come from other states other than Florida, even though we're located in Florida. It's because we become a medical tourism destination. The reason we do live streaming is so that I can teach everybody through these surgery videos. While I'm doing the surgery, I can show you what I'm doing and answer questions if you have them. What is that noise I'm hearing? Sounds like a fan. Is that for the laser?
Oh, yeah.
I don't remember hearing that normally. It's okay?
Yeah.
Okay, we were talking earlier about Dr. Day, Dr. Arthur Day, one of my mentors in neurosurgery. Dr. Day was a neurosurgeon, faculty, professor at the University of Florida in Gainesville. When I first met Dr. Day, I thought he has a very funny accent. Then I found out that he was a world-famous neurosurgeon for doing aneurysm surgery, revascularization, ECIC bypass, basilar apex aneurysm clipping, vascular malformations like AVMs and dural AV fistulas, cavernous malformation resection. He's basically one of the best in the world at doing brain surgery for blood vessel problems. And of course, many of the residents that I trained with, well, they had come to Shands Hospital just because of Dr. Day. As a matter of fact, he had doctors, neurosurgeons from all over the world that would come and watch him operate. Fellows from all over the world. Anyway, Dr. Day was a wonderful character, in my opinion. And he had from Louisiana, so he had a Louisiana accent. And he was always tan and good looking, hair slicked back, and always dressed, walked with style and elegance. And he was a great teacher. Residents loved him. He always taught us so much about the brain, how to do surgery on the brain, how to manage complex brain problems like ruptured aneurysms, vasospasm, hydrocephalus, etc. He was probably the most prolific teacher of all of our faculty. He spent the most time with the residents teaching them. And he was loved for it. So when I was on his service as a junior resident, my first year, I was very happy to be part of the team. And he would round almost every day on his patients with us. And of course, being the junior resident, you had to take notes and make sure that all of his orders were followed through. So we would always meet at Shan's Hospital down by the cafeteria to round, usually around 6 o'clock, 7 o'clock at night. We would start our rounds. And of course, rounds would generate a lot of work, because once you walk around seeing the patients for 2 hours from 7 to 9, then we would go have a quick bite and we would go get our work done on the patients that Dr. Day had just seen. So Dr. Day was a character, though. We would meet over by the cafeteria, and the first thing he'd do is he'd look to me or Dr. Tolentino, the other junior resident, and he would say, "Why, Ara, could you go get me a Diet Coke, please? And I like ice. I like the crunchy ice, not the cubes." And of course, what he was asking for was a Diet Coke with the crushed ice, not the cubes of ice. There were 2 ice machines in the cafeteria. One made cubes and one made crushed ice. So he wanted to make sure he got the crushed ice. He's very particular about that. But he was, again, a wonderful teacher, very patient, understanding. And if you didn't know an answer, he didn't lay into you like some of the other attendings did. Some of the other attendings, if you didn't know the answer, they wanted blood. Well, Dr. Day eventually went on to become the chairman of neurosurgery at Harvard. He spent a few years at Harvard as chairman and then ended up leaving. Now I think he's somewhere in Louisiana. I haven't really kept in touch with him. I don't know if he's still operating. I imagine he is. But you know, his specialty is a dying breed. He was a cerebrovascular skull-based surgeon. And all their diseases they did surgery on are now being treated endovascularly, with stents and coils, much safer, and glue, embolization. So he was sort of one of the last of his kind, a brilliant surgeon, very charismatic, caring, world-renowned for being an innovator, a pioneer, a master. And then I watched his profession die out. And all the surgeons that followed him into cerebrovascular, they died out too, right? Because who took over was the interventional radiologist. He's in Houston? Oh, nice. At Baylor or where? Well, there you go. If I was going to have anyone clip an aneurysm in my brain, it would be Art Day. He and Bob Spetzler were the 2 world famous neurosurgeons doing aneurysm surgery, AVM surgery. Of course, there were a few others.
I worked with Gary Duckweiler at UCLA. He was the coil surgeon back in the 90s.
Well, he was the what?
He started the coil, cerebrovascular coil.
Yeah. Yep.
Gary Duckweiler.
Duckweiler.
Have you ever heard of him?
No. So, but USC had a famous cerebrovascular Dr. Giannotta, who was friends with Day. And there was Dan Barrow. Bob Spetzler. These guys were like the dinosaurs of cerebral vascular surgery. They were the last of their kind. Masters, champions, but that whole field has died out and been taken over by interventional radiologists. Matter of fact, one of our most prestigious residents that followed in the footsteps of endovascular is now, I heard, looking for work. Can't even get enough work. There's so many endovascular surgeons. So, and he did neurosurgery, then endovascular. He's over in Orlando, as a matter of fact. Sad. I got lucky. I chose a good field where there was a bright future. You know, a lot of opportunity to improve, like we're doing here at Deuk Spine. Anyway, I share the story as I reminisce about Dr. Day and Dr. Roten, Dr. Barrow, Spetzler, Bob Spetzler. Famous people, mostly retired or on their way to retiring. All right, we're done with this one. It's just amazing to see the evolution of neurosurgery over the years, you know? Because not just with aneurysms and AVMs, but also with brain tumors. You know, now brain tumors are being treated with stereotactic radiosurgery primarily as a first-line treatment. So it's gone away from craniotomy, opening the skull and pulling out pieces of tumor out of the brain, to radiating with computer-assisted robots that guide the radiation. Collimators. But the one field that continues to expand is spine. And I think eventually maybe computer-brain interfaces, functional neurosurgery, you know, treating movement disorders and spinal cord injuries, things like that. That's a hot area too. What do I look like? Huh? Of course. For you, I do it. We're going to give a little more num-num for Dr. Berndes. He's a num-num addict. What is that?
That's I just worked hard to get the blood pressure where I want it.
Yeah, I appreciate that. Any questions? Shot?
No current questions.
Are you broadcasting, Shot?
Of course. Of course I am.
I kind of like the Diet Coke with the cubes.
Yeah.
I believe it's just the end of the day. Everybody's winding down.
Yeah, probably.
Oh, we got plenty of viewership.
Don't forget, I like the crushed ice. Shot. You know, but he's the kind of guy you would do anything for. Because he gave so generously every Thursday, his cerebral vascular conference for the residents. That was the best board preparation we ever had, Shot. Everyone talked about it too, you know. And what I'm talking about, for those who don't know, is in neurosurgery and every other field of medicine, when you graduate from your residency program and you start practicing neurosurgery on your own, you have to come back and take an exam called an oral board exam. And during that oral board exam, the examiners will sit down in a room with just you, the newly fledged neurosurgeon. There'll be 2 examiners in each room, which are really prestigious faculty of neurosurgery. They're chairmen or program or residency directors, experts in their respective fields around the country. And they've basically given up 2 days of their time to come and test you to make sure you know your shit. And If you don't, they won't pass you. And you have to come back another year and ask again to become a board certified neurosurgeon. And they don't make it easy. They ask you hard questions. Well, they want to push you to failure. See when you fail. As long as you know a good 70% of the information, 80% they ask you, you're fine. But Dr. Day's Thursday vascular sessions for 7 years taught us how to answer those questions properly and impress the examiners, of course. We had a wealth of knowledge and understanding as a result of his teachings. So, all that teaching and hard work paid off. Unfortunately, none of these doctors actually went out of their way to help me with the Deuk laser disc repair to get it more established. Had to do it all on my own. Which is fine. Now that I've made it, it just delayed it. So it would be nice if we could have accelerated the acceptance. All right, it's kind of dark. I don't know, I think the light's okay, or what we should do? It's still a bit dark. Right here, wipe that. Not sure, you check this connection here? Luis is good? Looks like that may be a little loose. All right, that's better. Those are all pieces of herniated disc. And they're floating out through the tube, which is good. Because if I have to grab each and every one of them, it's going to be a long afternoon.
Is that okay? Oh, yeah.
What's that?
It was down on the light.
Oh, no, it's just...
What's that?
It was down.
What was down?
The light was down.
No, it's... We
Well,
use
actually,
50%, should be fine.
Okay.
Yeah, yeah, yeah.
well, what it was where it connects here was
You
loose.
got over here, yeah, yeah.
Oh, okay.
But thank you, thank you.
But thank you.
I mean, it looks nice.
You guys are fine. It's perfect. Leave it alone.
Yeah, that's nice.
All right, we're working this L3-4 disc on the right side. You can see all the pieces of herniation floating around here. And I'm trying to release them by zapping them with the laser, getting them detached. We're detaching these herniation pieces from the scar tissue holding them onto the annulus tear. This is part of the annular debridement. If you read about the Deuk laser disc repair surgery, you'll see we do what's called an annular debridement. All right, I would like to say, since nobody's asking questions.
We do have a question, actually. Just came up.
All right, I'll say it anyway, and I'll get the question after. The Deuk Spine Institute has now created a sister company called Deuk Joint Institute. And Deuk Joint Institute's focus will be knees and hips and shoulders and other types of joints other than the joints of the spine. Of course, since we're siblings organizations all from the same parent, Deuk Spine Institute, the logos, the colors and everything, the staff will be almost the same. We have now bringing in an orthopedic surgeon to do some of the joint work, Dr. Davis, and Dr. Davis starts in a week, right? Now, Dr. Davis is very interested in what we're doing with the Deuk plasma rhizotomies. So he's coming and joining us. He's normally a joint replacement doctor. So he's done hip joint replacement, knee joint replacements for his whole career. And he does them outpatient, right? Like a lot of orthopedics are now doing. So he's an avant-garde surgeon. He's got a lot of experience. But when he saw the Deuk plasma rhizotomy done, he said it was like seeing something amazing. And he wants to be part of what we're doing. So he is coming here to start doing our knees and hip Deuk plasma rhizotomy. For those of you who don't know what that means, we have a way of killing the pain nerve to the knee and the hip and the shoulder with a minor procedure that takes literally 15 minutes. And in 15 minutes, that knee and hip and shoulder pain that you've had for a long time, years and years, can be gone without having major joint replacement, without having open surgery, just through a percutaneous procedure. All right, we'll take the questions. Look at all this damaged disc, the blue stuff, all the fragments and pieces floating around, just a lot of it. So even though the discogram didn't look bad with the disc being cotton ball, we call it, there's tremendous amount of internal disc injury. This was what was causing all of her back pain. She had 10 out of 10 pain here. All right, Henry, I'm sorry to keep you.
It's all good. Next question comes from Jamie on YouTube.
Hi, Jamie or Janie?
Jamie.
J-A-M?
J-A-M-I-E.
Like-
Jamie.
Like jammin'.
Jammin'. Sure.
Jammin' with Jamie.
Exactly.
like
They
it.
asked a few questions, actually, and the first one is, so are you fusing or clearing out scar tissue and perhaps moving/cutting bone from where the nerves are?
Great question, Jamie. We are not. So did you run the video on the Deuk laser disc repair?
Yes, we ran both.
Let's run it again. I'm going to show you because they say a picture's worth 1,000 words. Jamie, take a look at this video and you'll see what we're doing is we're cleaning up the tear in the back of the disc where the herniation of the nucleus came out of. When the blue stuff is the herniation. So not only are we cleaning the tear, but we're also cleaning out the herniation that's stuck in it. Let's run that educational video for Jamie.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, Jamie, hopefully you see from this video we just played that we're bringing the laser in to the tear in the back of the disc where the herniation is, and we're literally using the laser to clean out the tear. That's what you're seeing right now, the white thing. See all those little fibers right there? Those little white strands going around there, right there, underneath the glass? Those are annulus fibrosus fibers, and they're collagen. So right now it's trying to, this annular tear is trying to heal and close off, but it can't because it's got all this blue stuff in here, the nucleus that's herniated. So we're removing the herniated nucleus and cleaning the annular tear so it'll heal. When we're done, the body will be able to heal this disc on its own. All right? There is no fusion being done. This is a natural repair of the disc. This is far better than fusion. It's a much more advanced surgery than fusion.
We have a couple more questions.
Sure.
These next few are from Jamie, once more on YouTube.
All right, Jamie, you're firing away on that keyboard. Go ahead.
They asked, so is that herniation the liquid in the disc or the disc itself? And can you repeat what the procedure is again so I can write it out?
Yeah, you're going to change the irrigation? All right, well, Henry's going to write it down for you. Jamie, the procedure is called the Deuk laser disc repair. And the stuff in the center of the disc is not a liquid. Whoever told you it's a liquid, well, they lied to you. The stuff in the middle of the disc called the nucleus pulposus is a solid. It's solid. It's solid. It's just kind of squishy and a little bit wet. It's got lots of water. But imagine if you had a piece of wet shrimp in your fingers that you haven't cooked yet. Uncooked shrimp. And take the carapace off of it. That uncooked shrimp, that's what the inside of the disc is like. Wet, gooey, a little spongy and softy, full of water. That is exactly what the nucleus is like. It's not a liquid. Okay, a lot of people think it's liquid. It's not.
More gelatinous, right?
It's not even a jelly. It's firm. It's actually firm like a shrimp's uncooked body or a piece of uncooked lobster. That's how firm it is. You can see all the fibers right there. That's the annulus wall that was torn. And this is the top of the tear right here. This is the last part. And I'm cleaning this tear. Now, you can see all the fibers in there, right? That's because this is all scarred up from inflammation caused by the herniation in the tear. What you're watching here, Jamie, is the most advanced spine surgery in the world. It's not available everywhere because most doctors don't know how to do this surgery. But if they knew how to do this surgery, they would be doing it just like we do here at Deuk Spine. We've evolved way beyond fusions and artificial discs and destructive surgeries like laminectomy. We can do those surgeries any day we want. We have the ability, the equipment, the training, the technique. I've personally done thousands of them. But our customers don't want the old-fashioned stuff. Look at the inflammation tissue right there. It's pink. That is where the pain comes from, right there. And the whole core of this tear. All right, you said you had a few more questions, Henry?
Just one more at the moment, and this comes from W. Stroud on YouTube.
Hi,
And
W. Stroud.
they asked, hello, my question is, how much of the damaged disc can be removed without having to add some type of spacing material to keep the vertebrae separated?
Yeah, great question. We don't need to put any spacing material ever. You can lose 99% of your disc and have no symptoms whatsoever. Not having spacing material is not the problem. That's what doctors will tell you is the problem, but they're wrong. They're just trying to convince you to have fusion. So they're making that stuff up. They don't even know that this surgery can be done. So unfortunately, there's a lot of misinformation out there being spread by doctors to patients about how their disc is collapsed and they need to build it back up. And it's all bullshit. Don't believe it. It's complete nonsense. All right, just about done. We do this laser surgery on collapsed discs all day long, and the patient's pain goes away 100% every single time. And we don't put any spacers in. We don't build the disc back up. Now, they will heal their disc, the patients will, once we've done with the surgery. Their disc will actually build itself, but it will not grow the jelly in the middle back again. Once that's gone, it's gone forever. You don't need that jelly in the middle. All right. Just about done. 30 seconds left. This is looking good. I think we're done here. Just outside the disc, finishing up, removing any herniation outside, right there a little bit, just underneath the nerve. You can actually see the nerve probably. It's in the fat right there, so we're not going to get to see it today on her, not at this level. But you got a little scar tissue here, you can see that? I'm just cleaning that up. That's just underneath the nerve. Got to know your neuroanatomy. It's a good thing I know my neuroanatomy. All right, we're done. Now look how small the hole is, all right? The inside of this tube is about a little bit over 5 millimeters. So that hole is about 3 millimeters. Every time we finish, the hole is around 3 millimeters when we're done. So the surgery actually helps close the hole with the disc repair, but your body will close it the rest of the way. Takes about 9 months to completely heal. Any more questions?
No current questions, but we do have a comment from Jamie and W.S. Stroud as well. Jamie's comment, they had two comments. Jamie said, so I'm desperate to find a safe and effective procedure for my husband that has about 4 herniated discs, and he's in extreme pain 24/7. It's tearing him and us apart. And my dad has been talked into about 6 spine surgeries, and he's still really bad in bad pain. L4, L5, and S1.
Well, Jamie, first of all, thanks for being honest with us and sharing your story. And I hear that 1,000 times. Back pain never affects just the patient. It's always a family ordeal. And the loved ones always suffer with the patient. I mean, if my wife has pain, like she had last night, a headache, I just laid in bed with her and took care of her. And you worry about them all the time, and you worry about where their life is going. Here's the truth. We will cure your husband's back pain at Deuk Spine. There is nowhere else in the world that can do it, but we can do it. If you want to know the answers, get his MRI, upload it to our website, mri.deukspine.com. We'll do a free MRI review. It will cost you guys nothing. All you got to do is answer a few questions. Where's your pain? How long have you had it? What treatments have you had? That kind of stuff. And then the most important thing is, where's the pen? Shot, and we'll help him as well. Some num-num for Dr. Berndes. Let me have a skin knife. Will you pull this here? Pull this here. What happens is there's a little skin tag. Num-num. Shot. Any other questions?
No current questions. We do have a couple comments from W. Stroud and Jamie. And W. Stroud said, I had a fusion and I am really suffering.
Well, if you've had a fusion, we can fix your suffering. Because your fusion, if it was done well, which let's just assume it is, you're not suffering from your fusion. You're suffering from above your fusion or below. And I will figure it out. We can do that with our MRI review. So take advantage of Deuk Spine Institute's free MRI review. There's no marketing, no advertising, no money. You just come and I do an MRI review with you personally. We are getting backed up. We have a lot of people that want the MRI review. And, ultimately we can fix your pain. We just need to know where it's coming from. And MRIs will never tell you where pain comes from. A lot of people think the MRI says where the pain comes from. It doesn't. The MRI is helpful, it's useful, but it does not tell us where the pain comes from. You need a good doctor to tell you where the pain comes from. And you're not going to find that most places. All right, we're inside the disc. This is our last disc. Remember, we did this same disc, L4-5, on the other side. And we've already finished the right side, now we're doing the left side. This will be our last one. We'll be done in about 15 minutes. And I'll be happy to take your questions throughout the rest of the surgery. I'm Dr. Deuk, the CEO and founder, and this is Luis, if you want to put a staple. Luis is my right-hand man. For those of you who have been coming for a long time, we've been broadcasting these surgeries for 10 years here at Deuk Spine Institute. I need scope on 10 years. And by the way, 10 years ago when we started broadcasting, we were broadcasting fusions, primarily fusions, laser. I did a lot of fusions. We broadcast the entire fusion. If you go to our YouTube channel, hey, where's the pedal? If you go to our YouTube channel, you can actually see we have a playlist for cervical fusion, lumbar fusion, posterior cervical fusion, anterior cervical fusion. We even have some carpal tunnel surgeries. We have a lot of spine surgeries on there. About 1,000 surgeries, maybe more. Okay? And we have a lot of other information. You can watch some of our videos we produced.
We have a couple of comments from Jamie once more.
All right, Jamie.
Jamie said thank you because he's gotten to where he says he can't go on with this every minute. Her husband.
I understand.
Yeah.
Jamie, trust me, I get it. That's why Deuk Spine does pain, because we can fix your pain. We can fix his pain. We do it all the time. Jamie, go to our YouTube channel, go to our playlist, and watch some of the testimonials. Why don't you put a link, Henry?
Copy that.
Put a link to, we're going to put a link right now to some of our patients. And by the way, the testimonials, there's hundreds of them. Hundreds. And all of them are real patients with real surgery that we fixed. And this isn't even all of our patients. This is just some of them. Because we can't do all of them. We don't have the resources or time to do all the patients that we've treated. Even though we could, we'd have thousands of patients, testimonials. So we have just a few hundred there, but you should go through them and listen to these people's stories, okay? Because they're just like yours. And I'm going to tell you something, it doesn't end well if you guys don't get the care he needs. It doesn't end well. We need to fix our system, it's broken. That's why we broadcast, so people can see the truth, that there is hope. There is a way out of pain, and it's at Deuk Spine Institute. Um, 5 minutes. Had a very busy day today. We did 4 surgeries. The first one, a patient from Chicago, thoracic pain, radiating from T8, T9 area on his back, wrapping around his ribs on the right. Horrible pain. He's had it for 20 years. Nobody has been able to cure it for him. He's had plenty of shots, medication, therapy, chiropractor, everything. He's done everything except surgery, and nobody offered him surgery. Deuk Spine Institute cured his thoracic pain today. We also took out his spinal cord stimulator that somebody put in that didn't help him at all. That was our first surgery. You can go back and watch. Second surgery was a lady from Mississippi who's a musician. She came to us because she had herniated discs in her neck, and she was told by her surgeon she needed a fusion. That was her only choice. She didn't believe them. She didn't want a fusion. Got smart, started searching online, found Deuk Spine Institute, recognized that we were the only people to offer a solution that wasn't fusion, that could work better than fusion. So she came here, we did her surgery earlier, and she's doing fantastic. Then we had a patient from Boston, Massachusetts. He had a single level cervical disc herniation with radiculopathy, myelopathy, and neck pain, cervical brachial syndrome. We did his disc. It was a huge one, pressing on his spinal cord. We got it out with the laser beautifully. And now you have our final patient, a lady local who has 3 disc herniations, 2 at L4-5 and 1 at L3-4. And now we're just finishing. She had horrible pain in her legs from the nerves being pinched by the herniations. We're here removing the herniations. This is the last of them. And we've gotten rid of probably 80% of the herniation. Very nice. She's going to do fantastic. How do I know? Because we've done this thousands of times. We know. We've seen the results. All right. That's the end of the disc right there. You can see the tear. See the calcification of the fibers. A lot of scar tissue right there. Some herniation right there. And we're cleaning it up with the laser. By the way, all these surgeries are outpatient. They're done with a 1/4-inch incision. Patients go home while they go to their hotel, and I see them back the next morning for a quick checkup. And sometimes we get a nice testimonial. We have time. Problem is time these days. Have so many patients now. There's really very little time to do testimonials anymore. So we haven't done very many lately. I think Henry's behind, right, Henry?
A little bit, yeah, if I'm being honest.
All right. Any more questions?
Yes, we have another question from Jamie once more on YouTube.
2 minutes or 1 minute?
They ask, now are you sucking that tissue up, or is it burning it, or are you burning it off? Is that some sort of a ablation?
Yeah, Jamie. So we're blasting it into little pieces, and then they're being sucked up and out. You're correct. Coming up the tube. Sometimes you'll see a really big piece. We have to stop, and we gotta help float it up the tube. That's how it works. That's endoscopic surgery. You break up the herniation into little pieces, and then they float up. The reason the view is so cloudy is because this tube is full of little pieces of herniation floating up. All right.
No current questions, but we do have an additional comment from Jamie once more.
30 seconds. Yes, Jamie.
Jamie said, I believe her husband was diagnosed with colorectal cancer in 2018, and it's been a roller coaster ride of many
So sorry.
surgeries, chemo, radiation, and then 3 hernias and
I'm so sorry.
and a 4th now. So he / we have been going through hell, and the back, hip, pelvic, etc. pain nonstop.
I understand.
And it's really amazing what you can do.
Yeah, well, hopefully we can help you guys out. We can help him with his back pain, his pelvic pain. You know, maybe we can help with a stimulator, spinal cord stimulator. That's what stimulators are for. And, but definitely if he has pain coming from his discs, that's something we can fix. Okay? All right, we're all done. There's the nerve and the fat right there. See how small the hole is now that we're finished? It's about 3 millimeters. Great job, everyone. Henry, if there's no more questions, you're able to end the broadcast.
Copy that. There are no current questions.
All right. Well, why don't we go ahead and end the broadcast? We'll see you all Thursday for some more surgery. I will tell you this. We have a fusion on Thursday, a special fusion. We don't do many of them anymore. This is a posterior cervical laminectomy and fusion. Make sure you have it on the calendar, Henry, on the website.
Already is. I'll copy that.
Yeah, posterior cervical laminectomy and fusion. And it's going to be a big one. It's going to be beautiful. You're going to see all the anatomy, all the spinal cord, the nerves, the spine, the screws and rods, the whole kit and caboodle. I don't remember why it's a fusion, but I guess he's not a candidate for laser surgery.
Hey, Oscar, before tomorrow, can you change out this one specifically so that you use it this one? Thank you. Do you have an extra one of those? No.
All right, Henry, you can go ahead and play a testimonial maybe and end the stream.
Copy that.
Good morning, I'm Dr. Deuk. I'm here with one of my patients and friends who I've known for years, and she has been suffering with back pain for, well, I'll let her tell you how long. And a week ago she came and had the Deuk laser disc repair. She's here for a checkup, and I'll let her tell you how she's doing as well. So how long have you had your back pain for?
Started back in May last year, and I just couldn't get any relief from anyone. Finally, I asked you, and the rest is history. So this last week has been the best week of my life since May of 2022. So pain-free.
Excellent.
Yeah.
Now, I know it got bad last year, but did you have back pain on and off before that?
I did. I actually got thrown from a horse back in 2018 in Ireland. And that's what I think probably started it. I was having lower back pain, but never really did anything about it, just sort of lived with it.
Kind of modified your life, took
Yeah.
it easy, try to avoid things that aggravated the pain.
Exactly.
And now I know that you were suffering so badly before the surgery, and here you are with a smile on your face.
Oh yeah,
Yeah.
definitely.
Well, I'm so happy you're out of pain. You had the Deuk laser disc repair. You could actually see, we use a laser to clean the tear in the back of the disc where the pain comes from. The problem is most doctors don't know that's where the pain comes from, so they have no idea how to fix it. My years of doing endoscopic surgery taught me that that's exactly where the pain comes from. So it's a small little spot in the back of the disc. You fix that, the back pain goes away.
And it worked.
It's amazing.
It's like I told your wife, you're a miracle worker.
Oh, thank you very much. Is there anything you want to say to your fans out there?
I just highly recommend if you've had back pain in the past, don't live with it anymore. Call Dr. Deuk. He is the best.
Yeah, so many people's lives are just, quality of life is ruined by back pain.
It is, and not worth it. I'm ready to start traveling again, so.
Not too much too soon.
Not too soon, I know.
All right, very good, Jean. Great to see you.
Alrighty, thank you so much.
You're welcome.
I appreciate it.
Great to see you.
You too.